Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Narendra Modi says India has agreed on increasing joint investment in areas of water, energy, transport, space, health and food security. Nagaland to join nationwide free COVID-19 precautionary doses for 18 to 59 age groups from tomorrow. Vice President Venkaiah Naidu emphasizes on preventive measures to address burden of genetic diseases. And common university entrance test for Undergraduate 2022 to commence tomorrow. Now the news in detail. Prime Minister Narendra Modi today said that under the 12U2 framework, India, Israel, UAE, USA are working to increase investments in the fields of water, energy, environment, health and space. He said that the 12U2 has set a positive agenda from the very first summit, and by combining the skills of the nations, they can come together for the good of humanity. Addressing the first 12U2 summit in a virtual format, the Prime Minister said they will work towards ensuring food security and propelling development initiatives globally. He added that the joint projects in many areas have been identified and a roadmap has been made to move forward in them. He stressed that this cooperative framework is a good model for practical cooperation in the face of increasing global uncertainties. He expressed confidence that with the 12U2, a significant contribution will be made towards energy security, food security, and economic growth globally. Free COVID-19 precautionary doses for 18 to 59 age groups in the state will commence tomorrow as part of the direction of the Centre to provide free COVID-19 precaution doses for 75 days to mark 75 years of Azadi Mahotsav. In this regard, the Directorate of Health and Family Welfare, Nagaland, has asked all districts to open COVID vaccination centres to ensure all eligible beneficiaries to avail the facility. Vice President Venkaiah Naidu today emphasized the need to focus on preventive measures to address the huge burden of genetic diseases like thalassemia and sickle cell anemia in the country. He suggested taking up mass screening of the children for early identification and management of genetic disorders. Addressing a gathering after inaugurating the second blood transfusion unit and an advanced diagnostic laboratory at the Thalassemia and Sickle Cell Society in Hyderabad today, he asked the private sectors and NGOs to support the government's efforts in combating genetic diseases. Noting that treatment options are cost-intensive and distressing to the child, the Vice President called for a comprehensive approach to address the health challenge. He also assured that efforts will be made to ensure a law-making screening of thalassemia mandatory, stating that around 10 to 15,000 babies are born every year with thalassemia in the country. He asked media and all stakeholders to create awareness among the people. Lack of awareness about these genetic diseases is a major impediment to prevention and early diagnosis. Phase 1 of Common University Entrance Test Undergraduate CUET-UG 2022 will commence tomorrow in nearly 500 cities across India and 10 cities outside India. Under Phase 1, CUET-UG exam is scheduled to be conducted on 15th, 16th, 19th and 20th July 2022. The National Testing Agency NTA highlighted that all examination centres are under surveillance of CCTV and equipped with jammers to conduct fair exams. Nearly 14,90,000 candidates have registered for CUET-UG 2022, out of which 8,10,000 have been allotted Phase 1 and 6,80,000 have been taken in the second phase of the CUET-UG 2022 exam. The second phase of the exams will be conducted next month between 4th to 10th. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on News on Air app and YouTube channel AIR News Kohima. The Centre has extended a scheme for rebate of state and central taxes and levies ROSCETL till March 2024 to boost exports and job creation in the textile sector. The Ministry of Textiles stated that the rates of exports of apparel and garments will continue the same as earlier notified by the Ministry. Chairman of Apparel Export Promotion Council, Naren Goenka, said the ROSCETL scheme help in improving cost efficiency and export competitiveness in the international market. He said the scheme has provided a stable and predictable policy regime helping boost exports and employment. Goenka stressed that the scheme has also promoted the incubation of startups and entrepreneurs in the domain. He said the scheme also led to a large number of MSMEs joining the apparel export business. The Department of Consumer Affairs has set up a committee to develop a comprehensive framework on the right to repair. The aim of the framework is to empower consumers and product buyers in the local market and harmonize trade between original equipment manufacturers and third-party buyers and sellers. The committee, chaired by Additional Secretary in the Department, Niti Khare, held its first meeting yesterday, wherein important sectors for the right to repair were identified. They include farming equipments, mobile phones, tablets, consumer durables, automobiles, and automobile equipments. Its aim is also to emphasize developing sustainable consumption of products and reduction in e-waste. The Centre has written to all states and union territories reiterating some of the key actions that are required to be taken by them in line with Health Ministry's guidance issued on tackling of monkeypox. In the letter, Union Health Secretary Rajesh Bhushan said that continued spread of monkeypox disease globally calls for proactive strengthening and operationalization of public health actions for preparedness and response against the disease in India also. The Centre has also called for regular orientation of all key stakeholders, including health screening teams at points of entries, disease surveillance teams, doctors working in hospitals about common signs and symptoms, differential diagnosis, contact tracing, and other surveillance activities that need to be undertaken following detection of a case, testing, and clinical management. Screening and testing of all suspect cases must be ensured at points of entries and in the community. Dimapur District Task Force for COVID-19 today deliberated on precautionary measures and monitored the preparedness for possible rise of COVID-19 in the district. The meeting was convened by Deputy Commissioner Sachin Jaiswal, observing the rise of COVID-19 cases in the neighbouring states. During the meeting, the members discussed various steps for creating awareness on the importance of booster dose, wearing masks, and social gatherings through various platforms. CMO Dimapur, Dr. Mua Jami, informed that Dimapur has 18 COVID-19 positive cases currently, out of which 4 were admitted in Christian Institute of Health Sciences and Research. He informed that the district hospital has 11 normal beds, 50 oxygen-supported beds, 10 ICU beds, and 4 ventilator beds, while CHISR has 15 normal beds, 200 oxygen-supported beds, 17 ICU beds, and 11 ventilator beds. He also said that besides district hospital and CIHSR, some COVID care centres installed were also available with all the necessary logistics. The state reported 12 new COVID-19 positive cases, taking the active caseload to 52 today. 9 cases were reported from Kohima, 2 from Dimapur, and 1 from Mukukchung. Meanwhile, 1 person recovered from the infection. With this, the total number of positive cases reported in the state so far stands at 35,578. A total of 33,267 persons have recovered from COVID-19 till date. And now it's 20 news. Here are the main points again. Prime Minister Narendra Modi says India has agreed on increasing joint investment in areas of water, energy, transport, space, health and food security. Nagaland to join nationwide free COVID-19 precautionary doses for 18 to 59 age groups from tomorrow. Vice President Venkaiah Naidu emphasizes on preventive measures to address burden of genetic diseases. And Common University entrance test for Undergraduate 2022 to commence tomorrow. That is all we have in this evening news bulletin. Good night.